website. So if you want to view it again, or you want to share it with somebody, you can direct them to the website. So welcome, everybody. Thank you again for being here today. We're going to ask that you stay muted for the majority of the presentation, but if you have questions, please feel free to jump in, unmute yourself, ask your question, or if you have something to add. I believe we have some professionals that are also joining us today, so please feel free to jump in and add if there's something we're discussing that you have further information on. And you can also type your chats or comment questions or comments in the chat. So if you guys have come to any of our workshops before, I do like to start with this slide because I think it's important for people who are maybe looking for treatment for their kiddos or are already in treatment to kind of know what we as clinicians have to do legally, just to give you like a good starting off point. So in the state of Pennsylvania, the age of consent for mental health treatment is 14. So any adolescent that's 14 or older can say whether or not, basically say whether or not they would like to engage in treatment. And what this also means for caregivers is if they are in treatment, then they are the ones that are signing all their documentation. They're the ones that are signing their treatment plans. They're the ones that are signing their releases of information. So they can kind of direct their treatment in a way as far as like who can know what about what's going on. Now, I will say that we as clinicians are very much aware that they are still young and that their caregivers need to know things. So there are certainly times where we're having conversations with them or with you as a caregiver to try to coordinate either way without breaking confidentiality. We can break confidentiality for a couple of different reasons. If the individual is a harm to themselves or somebody else, or if there's any suspected abuse or neglect. So just wanted to put that out there. That's kind of like the parameters that we work within with our kids and teens. I'm not sure what the age group is that we're like looking at here, unfortunately, because we didn't have the ability to do a poll this time around. But I'm just going to go through this kind of like briefly to give you guys an idea of what is developmentally appropriate for children and teens so that you kind of have an idea of what like the milestones that you're looking for at certain ages. So children between the ages of 3 and 6 are at this point, they're developing the capacity for self-regulation and impulse control. They start to have a conscience, they start to have more self-esteem and an internalized sense of values. Their brain is still growing rapidly. Their motor skills are getting better. They're integrating functions of the left and the right side of their brain, which helps them to understand words and the emotional meanings of the words. Their relationships begin to focus more on peers and friendships begin to develop. Their memories improve and cause and effect thinking develops. They have egocentric thinking, which means that they struggle to take on the perception of others. So it's really more, it's all about them at this point. They do have guilt and they have little ability to pay attention. Between the ages of 6 and 12, children are able to self-regulate a little bit more. They have a sense of right and wrong. They can start to accept responsibility for their actions. The egocentrism does decrease a bit, but it's still there. They're more peer-oriented. Their self-esteem and view of self are more based on the acceptance of their peer group. And in this stage also, parents' attitude and circumstances can have a strong impact on the kid, especially with their transition to school. Their attention can be more focused, and they have a desire to receive approval from peers, which sets limits on their impulse control. They also have cognitive understanding of rules and norms of correct behavior. And once they hit the teen age, from the age of 13 to 18, the brain is still maturing. Now hormones are a factor. Adolescents develop the ability to think abstractly, set goals, and think long-term. They compare themselves to their peers, and the peer relationships and acceptance becomes extremely important at this time. Their ability for long-term commitment in relationship forms, and they may fall in love. And there's a struggle for independence and control, as they may want more independence from their parents, but they still have that egocentric thinking. So that's why, it's still all about them at this point. Oppositional defiant disorder. So this is like one of the reasons we're here today, right? Is to learn about this. There's not a whole lot out there about it. And it's often underdiagnosed because, and we'll get to this a little bit later, but there's a lot of things that are comorbid with it. And so the diagnosis that it might come along with it is a little bit more common. So then this kind of goes under the radar. But if you have a child that has oppositional defiant disorder, or ODD, these are the things that you are most likely going to be seeing. So they often lose their temper, they're easily annoyed, can be angry or resentful, argue with authority figures, especially their parents or caregivers. They deliberately try to annoy others, may blame others for their mistakes and misbehaviors. They might be spiteful or vindictive, and they might be non-compliant with rules. Conduct disorder, this is the other disorder we're talking about today, is slightly different than ODD. So there's two different subtypes of conduct disorder. So it can be diagnosed in childhood, and then it can also be diagnosed as in teen years or as an adolescent. It looks the same pretty much in either one. So you're going to be looking for these following things for somebody who would have conduct disorder. ODD can develop into conduct disorder. So if a child has ODD, in the younger years, and it goes untreated, it can develop into the conduct disorder as an adolescent as well. So when somebody has conduct disorder, you're going to be seeing they might intimidate others, threaten, bully, initiate physical fights. They may have used a weapon to cause physical harm to others. They may have been physically cruel to people and or animals, forced someone into sexual activity, deliberately engaged in fire setting, deliberately destroyed others' property, have broken into somebody's house, building, or car, and they lie or to obtain goods or avoid obligations. They also may have stolen items with or without confronting the victim, stay out past parental rules. So, staying out past curfew, especially this is more geared towards conduct disorder if it happens prior to the age of 13, if you're seeing this prior to. If they've run away from home, and they're often truant from school. So what causes this? There's a couple different things with most kind of disorders. So we can't pinpoint exactly what it is, right? There's a couple different factors that could play into this. One of them is genetic, the other is psychosocial. And within those, of course, there's other things as well. So with the genetic one, you might see in some people, like there's a decreased baseline for the autonomic nervous system, which causes activity, and that means that they need more stimulation to achieve optimal arousal. I'm sorry, I am not a doctor or a neurologist, but so basically what this means is like they are seeking more sensation because it takes them more than a normal person to reach that level of arousal that they need. So that's why you see them like arguing more or doing some more risky behaviors, because they're kind of like seeking out those kinds of things. But it's actually a genetic like brain thing that's going on. Somebody who has brain damage may also exhibit some of the symptoms of conduct disorder or ODD. The psychosocial things that could cause the ODD and conduct disorder are caregiver mental illness and or substance abuse. So when kids experience that or witness that, also if they witness marital conflict, if there's any abuse or neglect, if the caregiver has antisocial behavior, and what that means basically is, maybe they're into some legal trouble, or they might be causing harm to animals or to other people, and the child is or teen is witnessing that. And inconsistent availability and discipline. So that looks like, if you were to, or the caregiver were to say, oh, you know what, you can't do that. You're grounded for a week if you do that. And then the next time they do it, you allow them to do it. And then the next time they do it, they get disciplined for it. So then that gets kind of confusing and they start to not respond well to that. Traumatic life events. And the things that are listed above, some of them can be traumatic life events for kids and teens. So I kind of referred to this earlier, the comorbidity. So these are the diagnoses that come along with ODD and conduct disorder and sometimes mask it. So these are the ones that are more commonly diagnosed. So I'm sure that you guys have heard of these: ADHD, depression, bipolar disorder, PTSD, post-traumatic stress disorder, or intermittent explosive disorder. So these are the things, again, you see these often in kids and teens. Bipolar disorder, they're starting to diagnose a little bit more often in younger kids and teens. But the other disorder that isn't listed here that you might see is called disruptive mood dysregulation disorder, which basically is when they're having some mood issues and you're seeing anger and temper tantrums and stuff like that. So again, could look sort of like ODD and sort of mask it, which is why it, again, isn't diagnosed very often. Does anybody have any questions? I feel like I'm barreling through here. So how do we treat this? When it's not that common, there's not a whole lot out there. It can be a little bit difficult to figure out like what the best treatment would be. So if you have the diagnosis, the following are what is the most recommended as far as treatments. So there is medication. However, the medications are usually used for the comorbid diagnoses. So you're going to get medicated for the ADHD or the depression or the mood disorder, but really there's not a medication for ODD or for conduct disorder. Sometimes psychiatrists might prescribe something to help with anger, but like it's usually some kind of mood stabilizer that they're giving. So that isn't as common of a treatment for these diagnoses. The more common and strongly recommended treatment is individual and family therapy, especially family therapy. And within that, what you would see most is behavior modification. So that's when you're getting into your behavior charts and reward systems and things of that nature to try to change the behavior of the child or adolescent. There are higher levels of care. So the individual and family therapy is what Alex and I do at an outpatient level. So that's when you come in, your child or adolescent comes in, you meet with your therapist and you go home. But there are higher levels of care if the symptoms are severe enough to meet that criteria. So the highest level of care that you can have is inpatient. So there's inpatient psychiatric, which kids and teens will end up going there if they are a harm to themselves or others and they can't keep themselves safe. So they may end up in a psychiatric place for that. Those places, they don't come home. They usually have to stay there a minimum of 72 hours. And they see a psychiatrist, there's group therapy, there's individual therapy. They usually have a social worker or a case manager and usually do some family therapy while you're there. And then they try to refer you to the best level of care when they leave, the appropriate level of care. Another form of inpatient that you see sometimes, especially with ODD and conduct disorder, is residential treatment facilities or RTFs. So what they are, they're kind of like the last line of treatment. So your insurance companies and stuff are not going to say like RTF right away. Like you would have to show that you've tried every other level of treatment before it would get to that point where the child or adolescent would be recommended for such an intensive treatment. And again, so that one is where they would live there. And then they would be treated on site. So oftentimes these places are equipped with on-site schools that the kids attend. There are therapists, social workers, doctors that are all there that are treating the child or adolescent. And then they're discharged home eventually once they've reached their treatment goals. So you can work your way up to this level of treatment. And another way that you would get into an RTF would be through the court. So if you have somebody who is getting into some trouble or has been truant from school, or somebody who has a caregiver that is no longer able to care for them, then that's oftentimes where these kids and teens will end up. They are getting less and less, especially in Pennsylvania. The state's really trying to move away from that. So you don't see RTFs very frequently. A step down from inpatient is partial hospitalization. So what that is it's when the kids go, it's usually a 2-week program. They go from 9 o'clock in the morning until 3 o'clock in the afternoon. So they're missing regular school. Some of the programs will coordinate with the schools and they can do the schoolwork while they're there. But mainly the point of them being there is to get the help that they need for whatever's going on for them, as emotionally and psychologically. So they're getting a lot of group therapy. They usually have some individual therapy. There's usually a social worker, and then there's also a doctor there that would meet with the child or teen. Intensive outpatient is a step down from partial. So they are not going during the day, during the school day. Usually they have like a group or individual therapy after school, but usually it's a combination of both. So they're getting again, more treatment, and there usually is a doctor as well that would be seeing them. There's a service called Intensive Behavioral Health Services, also known as wraparound. This is when you have a team that comes out and meets with your child or adolescent and you, the caregiver, when they're in school or in the home. They are still doing this. During COVID, of course, I know they got really creative with how they were meeting with families. And there was a lot of virtual as well, but I believe that most of these programs are starting to come back in person if they're not already, which is great. But basically you have a team of people that come out and meet with the kid and teen and family, which is really nice. Family-based services is a more intensive level of that. So they're coming out to the kid or teen's home, school. There's usually 2 therapists on the team. They have like an on-call person. So if there is a crisis and you need help, you can call and you can get some support there. They also have a lot of resources that they can tap into as far as, getting your kiddo kind of like set up with anything outside of the home, like sports or clubs or scouts or summer camps, stuff like that. It's really a wonderful program. So some things you can try, and we'll go over this as well in a little bit more detail. Of course, I mentioned it before, behavior modification. So this is when you're looking at your behavior charts and your reward systems. It's really important to establish rules and limits and be consistent. That's like the key to like shaping the behavior, is like having the consistency. You want to have reasonable consequences, and a reward system can be put in place as well. Structured supervised activities are great, such as sports and scouts. It gives the kids and teens a chance to get outside of the home, but it's also something like that is a structured activity, but it's not with their caregiver. And creating a routine. So, this can be very challenging. So creating a routine, and if you want to try to change a routine, it's something that has to be done like in steps. Communication skills is another thing to try. So being clear, direct, and having specific requests. I want you to come eat dinner now. You need to come eat dinner now. rather than dinner's ready and expecting them to come eat dinner. So just like changing your language like that so that you're showing that this is exactly what you want and when exactly you want it. You want them to eat dinner and you want it to be done now, rather than like dinner's ready and expecting them to come. Giving verbal reminders. So, hey, don't forget your backpack. Don't remember your curfews at 9 o'clock tonight. Things that maybe they should know, but giving the verbal reminder can also be helpful, because then you can, if they don't comply, refer back to that and say, well, you know, we had this, yeah, I said this to you already. Giving realistic consequences. You don't want to give a consequence that you can't follow through on. You're grounded for the next month. You can't have your phone. I mean, nowadays, right, our phones are like attached to us. So sometimes that's not realistic. Sometimes it could be. It depends on your situation. But you want to make sure that whatever consequence that you're giving is something that you can follow through on. And building on positives is huge too. You know, oh, you did really well at baseball yesterday. I saw that you got a good grade on your math test. Thank you so much for cleaning up the dishes when you were done dinner tonight. Those kinds of things, just trying to point out what is happening that's also positive. Practice. Okay, so what we're going to practice here, Alex and I are going to do a little role play, and I'm also going to show a very, very basic way of doing a behavior chart. I've seen parents and teachers get super creative with this and like do all these really cool things with behavior charts. And you can do that. You can get like really creative and make it really personal, and, you know, whatever works best for your family, and you can make it fun. But I'm going to give you like the skeleton version of a behavior chart today, just to give you an idea of what it looks like and how to do it. So you can either unmute yourself or you can type it in the chat, but what are some behaviors that maybe you would want to see more of in your child that you would put on a behavior chart? Possibly, if anyone can throw anything out there.
Clean their room.
Ah, yes.
Do their homework.
Clean your room is I'm so glad somebody said that, because in a behavior chart, you can put clean your room, but what does that mean? Does that mean put your laundry away? Does that mean full dust? Does that mean vacuum? Does that mean make your bed? So there can be a bunch of different things within that you could put on the behavior chart to be a little bit more specific. So I'll for the sake of this, I'll put clean your room, but that's something to keep in mind. If you want them to clean their room, sometimes you really have to break it down into take your trash out, make your bed, vacuum, these things into like smaller steps.
Hi, it's Lisette. I don't have my video on. Hold on.
No problem.
For me, cleaning up the room is all of that.
Uh-huh. Agreed.
But it's without me having to tell you to clean up your room.
Mm-hmm.
Like, you should get up and clean up your room on your own.
Mm-hmm.
To me, that's a better, you know, I don't know how anybody else feels about that, but.
Well, sure. So that's like the expectation that you have, right? For your child, adolescent. And it's not an unrealistic expectation, but then when they're not following through on that, it's like, okay, so what's missing here? Like, how do we get them to actually follow through? And again, yes, it's one of those things that like, that should be understood. Like they should know that, right? And it's not even like they don't know that, but they still are choosing not to for whatever reason. And so that's where like the defiance and stuff comes in. And that's where it gets really frustrating. And we're going to talk about that too. And I saw in the chat, somebody said respect and get dressed for school. So we'll put those on there too. Respect is another one. So it's, again, what does that look like? what are you looking for when you want respect? And because it does look different to different people. Of course, I think, oh, well, you should know, right? Like they should know what respect looks like, but maybe their idea of respect is a little different. Or maybe they're like, well, what exactly are you looking for? Again, that like attention to detail and those ways that they just want to like push the envelope and get around it. So if you're super specific, it's harder for them to get around it too. And then also stopping screen time on time. I hear that one quite frequently as well. Okay. All right, so here's my behavior chart. My very basic, I hope you can see it, behavior chart. So here's my behaviors, and here's my like little squares, and I have the days on the top. So the days of the week. You can do it however you like. But basically what you can do here is you can somehow mark in these squares if they've done it or if they haven't done it. And if they've done it, so okay, yeah, you did your homework on Monday and Wednesday, and you cleaned your room on Tuesday, and you got dressed for school every day. But you weren't so respectful. Wednesday was a good day, but not any other day. So you give them something in their chart here. And what's a good idea is ahead of time to designate, okay, so if you can get, 5 stars in each category, then this is what you're going to get at the end of the week, or this is what you're going to get at the end of 10 days, or this is what you're going to get at the end of 15 days. So you want to make it obtainable, something that they can do, right? Okay, so maybe homework is really a struggle, and maybe doing homework 5 days a week is not realistic. Maybe we should try for 3. And if they can do that, okay, you did it 3 times this week, so now you can have 5 extra minutes on your iPad. Or, whereas like if you're saying like, I want you to do your homework 10 days in a row, and they haven't been doing their homework, that's going to be a tough one for them to just jump right into and be able to do that for 10 days in a row. Again, do these sound like unrealistic expectations? No, they don't. But if they're not used to doing them, we have to get them to the point where they're motivated to continue doing it. So if it's not, if the reward is not obtainable for them, they're going to get uninterested and they're going to stop trying. So you want to be able to give them the opportunity to succeed at it. And then you can push it. Okay, so you did your homework 3 times this week. That's great. Now let's do 5. Okay, now you know what? Let's do a week and a half. Now let's do 2. And you keep stretching it out until eventually you're to the point where they're doing their homework. And that's supposed to be how that works. Are there any questions about that? Okay.
I'm sorry, I wasn't quick enough. I do have a quick question.
Sure.
So I have 2 kids and they're younger maybe than the audience that you're talking about. They're 7 and 10.
Okay.
And they despise charts.
Mhm.
Like my daughter has like torn them up, destroyed it. So are there other visual ways maybe that to help them, because the chart's sort of like an issue for them because of us trying so many times in the past? I don't know if that makes sense.
Sure. So is there any other visual things that you have tried? Have you tried anything like, or have you tried something that is maybe not visual, I guess is what I'm really asking. So something like having, if you want them to get up and get dressed, like having an alarm set so that they get up and get dressed at that time. Or if they need to get off screen time at a certain time, maybe having an alarm or a signal of some kind that you would use with them in order for them to do something rather than like having the chart. Does that make sense?
Yeah, I've done things with like like on my phone, I'll set like an alarm or something, and the expectation of something happening, either a reward or them to complete a task. But that's tiring for me because it takes so much time to set it, and then Yeah. So, you know, it's not easy. It's tricky. These are tricky diagnoses, and it's tricky to work with the kids. And every time I feel like we got something that works, then the kids change their mind and we have to think of something different.
Right. Yeah. That I'm glad you're bringing that up because that is certainly something that happens. Yeah, it could work for a little while and then it might not work anymore. You're exactly right, which is again can be exhausting and frustrating. Another thing visually that I've seen people do is like a jar and putting something in the jar, whether it be like a marble or a stone or a pebble. So like every time that they do their homework or every time that they get off screen time on time, like you put something in the jar. And so when the jar gets to like maybe certain levels, then you can reward them with something, or when the jar gets full or however you would do that. So I don't know if that's something else, unless they're totally against like visual.
No, I like that idea. That would probably be better. I mean, it's just for my kids, sometimes if they see themselves like in their mind, they made a mistake. So if they were supposed to do homework 3 days and they only did it twice, that frustrates them. They get really mad. And that's when like they take it out on the visual.
Gotcha.
So,
Okay.
because it's like right there in their face, sort of blaming them in a way. But like putting marbles or pebbles or something, I don't think that would have the same, there's nothing tied to it necessarily. It doesn't say like this is a homework pebble or this is a, you know, it
Right.
just kind of shows progress without really being, yeah. So I think that might be a little bit more effective than like because we've done like the sticker charts and stuff, and that's what has
Right. Yeah. They don't always work.
I found just real quick that the pebbles and stone in the jar works really well for like the younger kids I work with, and the charts work really well for the older kids. I'm someone with pebbles and stone and marbles attracts kids' attention, and they get excited about putting that in the jar or counting in it. So I just wanted to say I've noticed that the pebbles and stuff works really good for the youngsters. Charts for the more of the adolescents and teens.
Thank you so much for bringing that up. Does anybody else have any questions or comments? Okay. All right. So Alex and I are going to do a little role play. And this may or may not look familiar for you guys, but we're kind of hoping that it might, so that you can relate to it. So we're going to try. I'm going to be the parent and Alex is going to be my teenager. And I have asked my teenager to do their homework. Hi, Alex, it's 5:30. I told you you needed to do your homework at 5 and you have yet to start it. Please sit down and do your homework.
Yeah, I'll get to it later.
No, you'll get to it now.
I'm not doing it right now. Clearly, I'm in the middle of something.
No. Remember, we've been through this. You need to listen to me.
Remember, we've been through this. Yeah.
Alex, no, don't even start doing this repeating me thing. You know how I feel about that.
How do you feel
This is about your homework anyway. Why are you bringing this up? Why are you trying to like just
I'm not
antagonize
doing my
me right
homework.
now?
I'm not doing the homework. I'm
This is
fine.
not
I'll get
up
to
for
it.
debate.
I'll
You
get
need
to
do
it
your
when I
homework.
get to it.
No, that is not how this works. You sit down and you do your homework right now. You're supposed to do it a half an hour ago.
Is that how it works?
All right, you know what? Fine. You're grounded for the rest of the month. I don't really care. I don't care.
Okay.
Or you know what? You can just fail. You can just fail school then. You can just fail.
Is that an option? I'm not doing it. So go ahead and ground me.
That's it. You're grounded. Done. Okay, so maybe we embellished a little bit there, but this is like the power struggle, right? So it's, I want you to do something and you don't want to do it. It could be reversed too, where they want to do something and you don't want them to do something. And it's so easy to get so engaged with them and get upset and get frustrated, and then nothing's getting solved. They're not doing what you want. You're getting frustrated and upset, and then it's over, right? That's it. So we're going to try this again, and I'm going to try a different approach to Alex. Alex, it's 5:30. I asked you to do your homework at 5 o'clock. Can you please sit down and do your homework now?
I'll get to it later. I'm in the middle of something.
What are you in the middle of?
Playing video games.
All right, Alex, you know, you can play video games when you're done your homework.
I will get to it later.
Alex, I'm asking you again,
I'm asking you.
please do your homework now.
Homework now.
Right.
I'll get to it later.
No, you're going to do it now. And that's the end of the conversation. And if you're not going to do it now, then the video game is coming with me and you don't have the video game for the rest of the night.
I'm in the middle of this and you talking to me is being really disruptive. I will get to it when I get to it. I'm
Alex?
doing fine in school.
All right, then that's it. If this is your final decision, you can sit down and do your homework now, or I can take the video game. What's your choice?
I'm not doing my homework.
All right, then I'm going to take the video game.
I'm not taking my video game room.
I'm absolutely taking your video game, Alex.
Well, I guess we take my video game and I'm still not doing my homework.
Okay, that's your choice then. So in this situation, I didn't necessarily win. She didn't do her homework, but I kind of won because I didn't get upset. I didn't engage her. I engaged her a little bit, but not as much as I did the first time. And I stuck with my consequence. And it was a reasonable consequence. Okay, so this is something that's important to you. And you're going to lose it for the night if you don't do what I asked you to. And I'm giving you a choice. Now you are in control of this. You can either choose to do your homework and keep your video game or not. So sometimes it's not a happy ending necessarily, but the more consistent you do it and you practice and you do it the same thing every time, and they learn that you're not messing around and like, oh yeah, okay, so I am going to get a consequence if I don't do this repeatedly. Hopefully, again, the behavior will change. Any questions on that?
Okay. I'm going to take over here. Alex, by the way. So I'm going to discuss this concept of window of tolerance. Here's our window. Every one of us humans, we have our own window of tolerance. Inside that window of tolerance, we can see things clearly. We can regulate our emotions clearly. We can see, for the most part, externally what's going on around us. We can kind of read the room. We're like a little bit more in tune with our feelings inside this window. So in this window, again, we're seeing things pretty clearly. We're pretty calm, regulating our emotions well. There are times when every human gets outside of their window of tolerance. So sometimes we go above our window of tolerance, and that's usually the hyperarousal. And sometimes we go below the window, and that's a hypoarousal. So above the window is when maybe we're anxious or panicky or angry. So this is when we could see the children you might be working with in the hyperarousal. So they're angry, they could be throwing things, they could be cursing, they could be hitting things. They are clearly outside of their window. When they're below the hypo, they could be shutting down, have the stone wall up, not talking to you, ignoring you. But either way, they are outside of their window. So when someone is outside of their window, they're not thinking clearly, they're not seeing things clearly, they're not going to see your perspective, they are outside. So what do we do when someone's outside of the window? Well, we try to get back in the window. If someone is above it or below it, the main goal and directive needs to be, how do we get back in? That's the only thing that needs to be in focus at that time, because there's no reasoning would be unreasonable. And when someone is outside of the window, for the most part, they're unreasonable. So let's just say someone gets outside, gets above their window, they're angry. The main goal needs to be like, how can we get them back down? What coping skills can we use to help them get back into that window so we can help them see things a little bit more clearly, or we can help them regulate their emotions. So let me think of an example. Let's just say in that scenario with Allison and I, when I was a kid, I ended up getting super mad and I end up cursing and I'm getting ready to throw my homework and I'm getting mad at my mom. There's no point of trying to reason with me at that point. I'm outside my window. My caregivers and my goal needs to be, how can I get back into my window? So that's when coping skills come in. Coping skills are things we use to distract to help regulate our emotions. Now, Allison, I'm sure, is not going to be happy in that moment to be like, she's probably outside her window too. So still, she's going to help me get back in by using coping skills, which I'm going to go over in a minute. After I've come back down into my window and I'm calm again, Allison can then talk to me again. Hey, we need to talk about what happened. But I notice a lot of time when I'm working with children and parents, when a child is acting out or they're upset, a parent will try to talk to them in detail what's going on in that moment. I think that might be a little bit of a waste of time because they're not inside their window. They're not thinking clearly. So when child is upset, goal is help them get back into the window. Same thing for caregivers. There's going to be times where you're going to feel upset and you're going to feel frustrated and you might lose your temper where you're not inside your window. So you might need to take a step away from the child, use your own coping skills and self-care tips to get back in. Because in that space, when you're back in the window, you can then make clear, reasonable decisions and see things from all different angles. Anyone have any questions on that before I go over some coping skills that could help? All right. So let's go over some anger management techniques. So let's go back to that window in my head, right? If let's just say your child gets outside that window and they're super angry, the goal needs to be helping them manage that anger. You might have to, as caregivers, help them and assist them using coping skills. Eventually, they will get used to doing them on their own. That's the hope. That's the hope here. So here are some tips. One is take a timeout or walk away. I always encourage kids, if they use the walk away, you have to let your parent or caregiver know when you're walking away, depending on where they go. But breaks are okay. I feel the need to say that they're okay is because a lot of times it might make someone more angry when a child or parent walks away because it could be seen as disrespectful. But in the heat of a moment, it might be best to walk away to calm down because, again, you're not inside that window anymore. Exercise is a very important one. That releases a lot of positive endorphins, some dopamine, and so that's if someone's below their window. Exercise is a really good one to come back up. Deep breathing, using a stress ball, coloring, so engaging in some kind of art activities, journaling, writing up a letter, ripping it up, and using your senses. So that could be like thinking of all the things in the room you could see, or asking your kid, like, tell me everything you hear right now. But really engaging all the different senses as a form of distraction. So the argument I get all the time is these, especially from teens, these coping skills won't take away my problems. Absolutely not. These will not take away your problems. Well, what they will do is bring you back down into your window of tolerance where you won't do something that you regret. So I don't know if anyone can relate to this, but when I work with some people, when they get angry, they look, and when they're back in their window, they look back and go, I can't believe I acted like that. I can't believe I broke my mom's favorite lamp. Like, not because they weren't in their window anymore. They're acting in ways which they wouldn't. So I explain to them, these skills will help you calm down to avoid making those decisions, to help you think straight. So now, of course, I know these don't take away the problems, but what they do is it helps bring down the anger so you can think clearly again and then think of what to do next. So back to the scenario with Allison and I, if I was a kid and I start getting really angry, she might encourage me to practice one of my calm down skills or my coping skills. And willing that I do, because you never know, that I calm down and later on we can talk about what happened and how to avoid it in the future. This doesn't always work effectively. This is going to take tons and tons and tons of practice and consistency over and over again. So it's not going to work the first, second, third, fourth, fifth time. It's going to take over and over again. And eventually, hopefully the child is able to eventually see, oh, I'm getting angry. I need to calm down now. I need to distract myself, and then I can make a decision. In the meantime, the caregiver role will come in and really help them practice these skills. You will most likely get pushback. Most likely, if someone's really angry, if you say deep breathe, they're going to be like, I'm not deep breathing. It's all about finding what coping skill might work for them. And these are just some of them. There's so many different coping skills out there. It's about just finding ones that are healthy, that won't hurt them more and will help them calm down and get back into that window again. Anyone have any questions on that?
I was just going to add that, like, what we do oftentimes in our therapy sessions, and our kids and teens give us pushback too, is we make them practice these things when they're not angry, when they're not anxious, when they're not sad, because they're inside their window, so they can retain the information and understand what we're talking about. And they're like, oh, like, this is so stupid. But like, then when they are angry, the hope is like that they are able to access those things that they practiced when they were calm.
So a lot of practice. Okay, so one thing you can help your kid or what they would work on in therapy is just identifying their triggers. So this anger meter here is one way to help a kid understand their triggers and what makes them mad. The more someone is able to identify what's triggering them, the more they're going to be able to build self-awareness and know, oh, this is time I need to cope now before it gets too late, or they're acting in ways which can get them in trouble or cause harm. So for example, you would have them say, what's level 1 of your anger? Someone would say, at 1, I'm not that angry. Okay. Level 2, how do you feel? I feel pretty angry, but I'm still pretty calm. Like I just start to get a little irritated. 3, I start to snap. I start to talk back to my parents. 4, I start to ignore and I start to roll my eyes. I start to mumble under my breath. 5, I start to curse. I start to think about hitting things. 6, my face gets really red. My fists start to clench. I think really bad things. 7, I start to hit things. I start to scream. I start to break things. 8, and then so it goes up from there. So the purpose of doing that is 1, to they can raise awareness of what's going on in their body and their feeling. And 2, they can start to catch, oh, this is that thing on the meter. This is when I need to cope. So that person, this example, 3, they start to feel a little irritated. They start to talk back. That's probably when they need to start using their coping skills. That's when they can walk away and use those anger management skills we discussed to help them bring them back down. Does that make sense? On this meter here too, I might have a child write examples of things that make them angry too. Because the more we can identify what makes them angry, the more we can be proactive in helping them cope with those situations rather than just letting them go and then becoming reactive. So there are some things you can do to be preventative. So I just discussed just helping them see their triggers. So number 1, help them understand their triggers. Help them understand what upsets you. How do you feel it in your body? What's going on there? So that's number 2, help them understand where the anger is in their body. Do you feel it? Is your heart racing? Does your face get really red? Is your mind start to spin a little bit? Are you clenching your fist? Do you feel like your face is flushed, like face is flushing? Help them see where are you manifesting the anger in your body. That way they can identify their symptoms and know, okay, I need to cope now. Help them build their coping skills box. So you don't really have to build a box. I do have some of my clients build their own box. It's easy. You want to have coping skills that are quick to use though. So if they start to get upset, you can say, all right, why don't you go, go sit down and use your coloring? Or why don't you go journal and write a letter about how you're feeling? Or why don't we deep breathe together? You want to have things quick that they could use that can help them cope. So building a box can be helpful. So that could be getting like a shoebox and putting down like a stress ball in there, or a fidget toy, or a journal, or crowns, something they can use to go help them calm down. Assist them in practicing coping skills. So like I said, this is going to take a lot of practice, and that's okay. Just really assisting them. Like I said, there's going to be times you might feel frustrated too. But in that moment, just remembering there's no reasoning with the unreasonable. I just really need to help them focus and coming back down to the window. And then I can talk about what the consequence is. And then I can talk about what made them act that way. And then I can talk about what we're going to do next time to prevent that from happening again. But in that time, I'm just going to help them practice these skills to come back down. Then I can reason with them. And lastly, help them understand the emotions they're experiencing. So we talk about anger a lot, but anger is typically a secondary emotion. What else is happening there? Did someone upset you? Do you feel embarrassed? Do you feel rejected? Do you feel guilty? Help them understand all the different feelings and normalize them. It's okay to feel these feelings. It's just not okay to react with them sometimes. We can feel these feelings and that's okay. We just need to learn to deal with them in a really healthy and productive way, so you or someone else doesn't get hurt. Any questions? So how you can help in a crisis. So obviously there's going to be times where a situation does escalate. So number one thing to do is stay calm. Can't meet crisis with a crisis. I also say it to some of my clients, you can't put down a fire with fire, right? That just makes the fire bigger. So staying calm. Remembering me screaming back or yelling back or cursing back or freaking out back, that's just only going to make the crisis seem bigger. So staying calm. And one thing I do if there's a crisis that helps me stay calm is I just keep my voice kind of calm, because it does help me stay regulated in that moment. Help them see you are in control. Screaming doesn't necessarily symbolize them I'm in control. Staying calm is showing and modeling to them I'm in control of the situation and we're going to get through this and this is safe. So again, assist your child in coping. So again, they're outside the window, just continue to assist them in coping. They're unreasonable at this time, just help them cope. Talk about it after. So this is really important. So I know a lot of parents like, no, I need to talk to them what they did wrong. I'm like, yes, 100% you do. Wait until after they calm down, because remembering they're not listening or they're not seeing things from your perspective at that time. They're outside that window. So yes, please talk about it after. That's a really important step so they understand. But wait until after the crisis, after they calm down, after they have rest, after they breathe. And after you give yourself time to calm down too, because this is a lot. So avoid talking about it in the moment. Like I said, there's no reasoning with the unreasonable, and assess for safety. So that's always going to be an important step. Like, do we need to get someone involved here to keep them safe? Are they hurting someone? Are they threatening to hurt themselves? That's when you want to contact crisis or 911 to make sure that we keep them safe too.
So taking care of yourself as the caregiver is so, so important, especially with kids with this diagnosis. As we mentioned before, it is exhausting and it can be extremely frustrating. So being able to have some way of taking care of yourself is super important. I mean, it's important in general, but especially important in these situations. On this slide, there's a couple different examples of different types of self-care. So please glance over them, make mental notes or write down things that maybe could work for you or things that you already do, so that you have something that you can kind of resort to when you need to do that, when you need to take that time for yourself. So ways to take care of yourself and avoid the power struggle. So the power struggle is the back and forth, right? Where you're like, and it just feels like you're stuck in this back and forth with the child or adolescent. So some things you can try are walking away and taking a time out when you're feeling frustrated, disengaging from the conversation. So kind of like what I was trying to do with Alex in the role play of like, okay, I'm not going to continue to have this conversation. If this is the decision that you're going to make, okay, then I'm going to take the video game and it's going to be done. We're not going to continue talking about it. Well, and again, as Alex said before, like walking away and taking a time out sometimes it's just needed, because it could just be worse if you don't. They might follow you. They might be talking at you as you're walking away. As long as you can block it out, take your deep breaths, do what you got to do. That's important for you to just be able to get your time out, even if it's like shutting yourself in the bathroom, which I have had parents do. As I said, ending the conversation rather than engaging with them, finding positive activities that you can participate in without your kids. So if you like to play music or go to the gym or take a walk, or if you have a dog that you want to take to the park, or maybe you don't have that kind of time, but you could, take a bubble bath or take an extra 5 minutes in the shower, or read a book for a couple minutes before bed, or have your favorite dessert, whatever it might be that you can do for yourself, by yourself, or with a friend or your significant other, but without your kids, to have that separation. Something to keep in mind is tomorrow's another day. So, maybe it was a really rough Monday and there was a lot of fighting, there was a lot of arguing, there was a lot of maybe tears, and you wake up on Tuesday, and what you want to try to avoid doing is going, well, I am still so upset with you from yesterday. I cannot believe you behaved that way, because you're just setting the stage for the same kinds of things to occur. So tomorrow is another day. Let's start fresh. And we'll go from there. Now, of course, there's going to be times where consequences maybe leak into the next day, but you don't need to hold a grudge. Having empathy and being able to manage your own emotional reactions in the situation. So like Alex was saying, if you can stay calm, you're modeling for them, and you're also showing that you are able to be in control of yourself, and therefore it looks like you're in more control of the situation. Having empathy. So trying to remember, okay, yeah, they're only 10 years old, or they're dealing with a lot right now, or yeah, I guess it is kind of hard to do, science, math, social studies, and English homework all in one night. Whatever you can do to try to empathize with your child or adolescent, it can help to reduce the frustration. And picking your battles, trying to fight every little thing is super exhausting. And it's kind of helps you to spin your wheels, because then it's harder to gain traction and make progress in other areas. So what you want to do is being able to focus on certain things that are really the things that you want to change. So whether it's doing homework or talking back, eating dinner on time, coming home at curfew, not hitting your sister, whatever it might be, but you have to pick what are the things that are most important to you, that you feel are the things that need to change, and focus on those things first and then keep adding. But doing everything all at once is going to be exhausting. So this was really difficult to find because there's just not a whole lot out there on these disorders. But as I was I don't know if I mentioned this before actually, but conduct disorder is not seen all that much, except if the child is adjudicated delinquent. So when the juvenile offenders, 31 to 77% of them have conduct disorder. So that's where you see it the most, after they've already offended and are in the legal system, which is a shame. 1 in 16 school-age children has ODD. So that means that probably if your child goes to public school, there are probably at least 2 kids in their class that have ODD. So it's probably more frequent than it is diagnosed. 2 to 5% of children between the ages of 5 and 12, and 5 to 9% of the adolescents between ages 13 and 18 are diagnosed with conduct disorder. Just because your child has conduct disorder does not mean that they are going to develop antisocial personality disorder. That's the one that I've had parents who are like, I just don't, I don't want to see them get involved in the legal system. I don't want them to be in jail for the rest of their life. I don't want them to turn into this or that. It doesn't mean that. It's as long as you're getting treatment and you're working with your child or your adolescent and you're getting them the support and the help that they need, the prognosis is pretty good. For children who have conduct disorder, at a younger age and they don't get treatment, the prognosis is not as good. So what you want to do is you want to be able to get your child or your adolescent into some kind of program, whether it be with a therapist or group therapy or some kind of structured activity to try to help with these behaviors, and then the prognosis gets better as the more help and support that they get. Are there any other questions or comments or things that you would like answered before we close for today? And sorry, we did go just slightly over time.
I have a quick question. Do you guys know of any support groups for ODD?
I wish I
I-
did.
I can direct you to NAMI is wonderful, the National Alliance for Mental Illness. And they, if you Google them, they have all kinds of different support groups. So you could start there, but there's really not a whole lot out there, unfortunately. There may be more support, and Alex, I don't know if you know this, but maybe there's more support groups for parents and caregivers who have children with this diagnosis rather than the kids.
Yeah, I
To be
agree with
honest with
that.
you.
Yeah.
There might be, I know NAMI has parent groups as well.
Yep.
That can be parent support groups.
Okay, because I was looking for support groups and I found them. And then it was like a year before COVID hit. Then they were organizing and then COVID hit. So I wasn't sure.
That's a shame too. COVID. Yeah, not anything off the top of my head. I apologize. But I think NAMI, NAMI, is a good place to start if you were looking for that. We did have another question in the chat. Can children under the age of 5 show symptoms of any of these? And the answer is yes, they can. So if you're looking, it's more difficult to diagnose under the age of 5. They can be diagnosed, but because of the developmental stages that they're in, I don't know that they would always be diagnosed that young because of, that at that age, like under 5, like they're testing limits and stuff like that development, and that's developmentally appropriate. However, I mean, there are of course lines to cross. So if they're like going way far beyond just like testing some limits, then you might be looking at a diagnosis. Are there any other questions or comments? All right, well, thank you everybody again for coming to our workshop and participating. We really appreciate it. And if you need to view this again, it's on our website, or if you need to share it with somebody, you can direct them there. And I hope you all have a great night. And if you need anything, you can also just reach out to Alex or I. Thank you so much.
Yes, thank you, everybody.
Thank you. Bye-bye.
Bye.
Bye.